and the lower end. Upper end has expanded portion that is known as the lateral and medial condyle of the tibia, and in between the two condyle there is area, non-articular area, that is known as the intercondylar area, and in the middle of the intercondylar area there is two elevation that is known as intercondylar eminence, and this articular surface articulates with the similar articular surface present on the inferior surface of the condyle of the femur for knee joint formation. Now, the anterior surface of the upper end there is elevation that is known as the rough elevation, that is known as the tibial tuberosity for attachment of ligamentum patelli. And on the lateral surface of the lateral condyle there is another attachment that is known as that is for attachment of the iliotibial tract. On the lateral side of the thigh, thickening of the passa lata on the lateral side of the thigh, that is known as the iliotibial tract, which is attached below with the lateral condyle of the anterior surface of lateral condyle of the tibia, and above it is attached with the tubercle of the iliac crest. This tubercle from here to here. Clear? Now the sac, it has anterior border, medial border and lateral border. This medial border is sharp, subcutaneous, no muscular attachment, and this is known as the shin. That's why tibia is known as shin bone. And anteromedial surface there is three muscular attachment, otherwise it is subcutaneous, and these are three muscular attachment, that is sartorius, gracilis and semitendinosus. Three muscles inserted in this region, and in the anterolateral surface and muscles of anterior compartment of the leg are originated and present, and lower end in the posterior surface there is oblique ridge. There is oblique ridge. This is known as the soleal line for origin of the which gives origin to the soleus muscle. And above that, this surface there is insertion of the popliteus muscle. And below the oblique ridge, soleal line, it is divided into medial and lateral part by vertical line. And medial to the vertical line, there is origin of the flexor digitorum longus. And lateral to the vertical line, this gives origin to the tibialis posterior. Now the lower end, lower projected portion, that is known as the malleolus, medial malleolus in the ankle. And the medial side of the ankle there is a projected portion that is known as medial malleolus. Now this lower end in its inferior surface there is articular surface for articulation with the talus, forming the talopural joint or talotibial joint or ankle joint. And on the lateral part of the lower end there is notch, that is known as the fibular notch. Fibular notch forming the tibiofibular joint, inferior tibiofibular joint. This fibular notch. This is about the general features of the tibia.